Did you know how dangerous a snake bite can be? Snakes with their slithering bodies and sharp fangs can be quite a scare, but their bite can be lethal. Let's talk about snake bites. Globally, snake bites are a significant health concern. Each year, between 4 and 5 million people are bitten by snakes, and a large number of these bites lead to snake poisoning or snake envenomation. This is a serious condition caused by the injection of venom into the body through a snake bite. The venom, a complex mixture of proteins and enzymes, can cause a range of effects, from mild symptoms such as pain, swelling, and nausea, to severe health complications like tissue damage, organ failure, or even death. Now, not all snake bites are created equal. The severity of snake poisoning is determined by multiple factors, including the species and size of the snake, the amount and potency of the venom, the location and depth of the bite, and the victim's age, health status, and immune response. For instance, bites from large venomous snakes like cobras, vipers, and rattlesnakes are often more severe than those from smaller snakes. Their venom can cause rapid onset of symptoms and severe health complications. On the other hand, bites from non-venomous snakes or venomous snakes with less potent venom may only cause mild symptoms. However, all snake bites should be treated as a medical emergency, as it can be difficult to quickly identify the snake and predict the severity of the bite. It's important to note that even non-fatal snake bites can cause significant morbidity. They can lead to local tissue damage, infections, and long-term physical and psychological trauma. So, snakes may be fascinating creatures, but their bites can have serious consequences. Therefore, it's crucial to understand the difference between venomous and non-venomous snakes, as the treatment varies significantly. Did you know that not all snakes are venomous? In fact, out of the 3,000 species of snakes, only about 600 are venomous. Now, let's understand how to differentiate between venomous and non-venomous snakes. Remember, this isn't a foolproof guide, as there are always exceptions in the animal kingdom, but it's a good start. First, let's talk about physical characteristics. Some venomous snakes have triangular heads, in contrast to the oval heads of many non-venomous species. However, this isn't always the case. Another way to distinguish them is by their eyes. Venomous snakes often have elliptical pupils, while non-venomous snakes usually have round pupils. But again, this isn't a rule set in stone. A more reliable characteristic is the presence of fangs. Venomous snakes are equipped with specialized teeth or fangs to deliver venom into their prey. These fangs are long, sharp, and often retractable. Non-venomous snakes, on the other hand, lack these specialized fangs. They instead have a series of small, sharp teeth that they use to grasp and hold their prey. Now, let's talk about the venom itself. Venom is a complex cocktail of proteins and enzymes that serves two main purposes for the snake. It helps to immobilize the prey and also starts the digestion process. Some venoms can even cause severe reactions in humans, leading to symptoms like pain, swelling, and in severe cases, systemic effects like blood clotting disorders or paralysis. Non-venomous snakes, however, do not possess these venomous capabilities. They rely on constriction or the simple act of overpowering their prey to subdue it. So, the difference between venomous and non-venomous snakes isn't just about the venom, but also about the physical characteristics and the way they hunt. Of course, the best way to stay safe is to give all snakes a wide berth, as even non-venomous snakes can deliver a painful bite. Knowing the difference can be a matter of life and death. Now, let's delve into the severity of venomous snake bites. Ever wondered how much venom from a snake bite can be fatal to humans? It's a chilling thought, isn't it? Well, today we're going to delve into the world of venom, potency, and lethal doses. To begin, let's introduce the concept of LD50. In toxicology, LD50 refers to the lethal dose, 50%, or the dose of a toxin needed to kill 50% of a test population. This is usually measured in milligrams of venom per kilogram of body weight. LD50 allows us to compare the toxicity of different venoms, but remember, individual reactions can vary based on a multitude of factors, including the victim's size, age, and overall health. Now, on to the snakes. Different species of venomous snakes have different LD50 levels. For instance, the inland taipan, a snake native to Australia, boasts the most toxic venom to mammals. The LD50 for its venom is staggeringly low, meaning it takes only a tiny amount to be potentially lethal. On the other hand, the king cobra, one of the largest venomous snakes in the world, has a higher LD50, meaning its venom is less toxic. But don't be deceived, the king cobra can deliver a massive amount of venom in a single bite, which can still be fatal. The black mamba, native to Africa, is another snake with highly toxic venom. Its venom's LD50 is relatively low, and a bite without prompt treatment can be deadly. And we mustn't forget the many venomous pit vipers, like the eastern diamondback rattlesnake, whose venom has a higher LD50, making it less toxic than some, but still dangerous due to the large quantity it can inject. These are just a few examples, but they illustrate the point. The danger of a venomous snake bite depends not only on the toxicity of the venom, but also on the amount delivered. While it's scary to think about, understanding the fatal doses can help us appreciate the importance of prompt and proper treatment. So, next time you're out in the wild, remember, respect these fascinating creatures from a safe distance, and let's leave the handling to the professionals. So, what should one do if bitten by a snake? Panic, run, scream? No, the key is to stay calm and seek immediate medical help. When a snake bite occurs, the first step is to keep calm. Panic can accelerate your heart rate, causing the venom to spread faster through your body. So, it's crucial to keep your cool. The bitten area should be kept below heart level to slow down the spread of venom. Avoid unnecessary movement. Moving can increase your heart rate and speed up the spread of venom in your body. If possible, be still and wait for help to arrive. And remember, never attempt to suck the venom out, contrary to what you might have seen in movies or read in old wives' tales. Emergency medical help should be sought immediately. Call for help, or if possible, have someone else make the call. It's important to describe the snake's appearance to the medical personnel, but don't attempt to catch the snake, as this could lead to additional bites. Now let's talk about antivenom, also known as antivenin. It's a medication made from antibodies that can neutralize specific snake venoms. It's derived from the venom itself and is designed to bind to the venom in your body and neutralize it. But it's not a one-size-fits-all solution. Different snakes have different venoms, and thus, different antivenoms are needed for different snake bites. That's why identifying the snake, if possible, is so important. The effectiveness of antivenom largely depends on how quickly it's administered after the bite. Hence, the adage, time is venom. The sooner the treatment begins, the better the outcome. Hospital treatment is crucial, even if you think the snake might have been non-venomous. Why? Because it's not always easy to tell venomous and non-venomous bites apart, especially in the immediate aftermath of a bite. In the hospital, doctors can monitor for signs of venom poisoning and administer antivenom if necessary. A snake bite can lead to complications if not treated promptly. These could range from local effects like swelling, bruising, and tissue death to systemic effects like breathing difficulties, irregular heartbeat, and, in severe cases, organ failure. So when it comes to snake bites, it's better to be safe than sorry. Always seek medical help. Even if you think the snake was non-venomous or the bite seems minor, it's better to overreact than underreact when your life could be on the line. Remember, time is of the essence when dealing with snake bites. Immediate medical attention could be a lifesaver. So, there you have it, a comprehensive overview of snake poisoning. We've journeyed together through the treacherous terrain of this topic, from the initial shock of the introduction to snake poisoning to the intricate details distinguishing venomous from non-venomous snakes. We've demystified the term fatal doses and shed light on the seriousness of this issue. Above all, we've armed ourselves with the knowledge of proper management and treatment of snake bites. Remember, it's not just about surviving the bite, but also about minimizing the aftermath. Swift and appropriate action can be the difference between a close call and a life-altering event. In the face of danger, understanding is our greatest weapon. And with this understanding, we can navigate the world with a bit more confidence and a lot less fear. Stay safe, stay informed, and remember, not every snake is out to harm you. Knowledge is your best defense.